Every week in my clinic, I see the same thing. A parent comes in and says, my doctor has recommended occupational therapy for my child. And the very first question is, what is occupational therapy? How does it work for my 2-year-old? This panic is completely understandable. And today, I want to answer it fully. What is occupational therapy for kids? What does an occupational therapist actually do with your child? When should you consider it? And what should you realistically expect from the process? Now, the word occupation in occupational therapy does not mean a job. For a child, their occupation is play, learning, self-care, and participation in daily activities. These are the things that are most meaningful and important for a child's development. An occupational therapist works with children to help them perform these activities more effectively. They assess the underlying skills, sensory processing, motor coordination, attention, and daily living skills, and then design a targeted intervention program. Think of it this way. If a child is struggling to hold a pencil, sit still in class, button their shirt, or tolerate the texture of certain foods, an occupational therapist is the specialist who addresses these specific challenges. When an occupational therapist sees your child for the first time, they conduct a structural assessment across 5 domains. First, sensory processing. How does your child's nervous system respond to touch, sound, movement, and taste? Are they oversensitive, undersensitive, or seeking more input? Second, fine motor skills. Can they grip objects appropriately for their age, use scissors, manage buttons and zips? Third, gross motor skills, balance, coordination, body awareness. Fourth, activities of daily living, dressing, feeding, and basic self-care. How independent is the child for their developmental age? And fifth, attention and executive function. Can the child sustain focus on a task, follow multi-step instructions, shift from one activity to another? This full picture is what allows the OT to build a program that is truly individualized. Now, here is where most parents are surprised. Occupational therapy for children looks like play, but it is structured, goal-directed play. A child working on sensory processing might play in a ball pit, swing on a suspended swing, or do activities involving different textures. Not because it is fun, but because these activities are carefully calibrated to help the nervous system self-regulate. A child working on fine motor skills might use Play-Doh, pegboards, or scissors with specific therapeutic intent behind every task. At our clinic, our occupational therapist uses a combination of sensory integration therapy and structured skills building. The sessions are child-led where possible, because when a child is engaged and motivated, the nervous system is primed to learn. One of the most important concepts in occupational therapy for children with autism or developmental delays is sensory integration. Let me explain this clearly. Our brains receive information from 7 senses, not just the 5 you know. In addition to sight, sound, taste, smell, and touch, there are 2 more. Proprioception, our sense of body position, and the vestibular system, our sense of balance and movement. In children with sensory processing difficulties, one or more of these sensory systems is not processing information accurately. As a result, the brain is either overwhelmed, which causes meltdowns, avoidance, and withdrawal, or understimulated, which causes the child to seek intense sensory input through crashing, jumping, spinning, or mouthing objects. Sensory integration therapy works by providing the nervous system with graded, organized sensory experiences in a safe environment to help it learn to process input more effectively. Occupational therapy is most effective when the strategies are carried into the home environment as well. This is something we spend significant time on, training parents. Some practical things you can do at home. For children who are sensory seeking, meaning they need more input, activities like deep pressure massage, jumping on a small trampoline, or carrying slightly heavy objects like a backpack can help. For children who are sensory avoiding, meaning they are easily overwhelmed. Strategies include reducing visual clutter in their room, using noise-cancelling headphones in busy environments, and introducing new food textures very gradually. But here the important thing we should remember is these strategies must be individualized from child to child. Always do this in consultation with your therapist. When should you seek an occupational therapy assessment? If your child is between 18 months and 3 years and you are seeing delayed motor milestones, very limited food acceptance, or extreme sensitivity to touch or sound, get an assessment. If your school-age child is struggling with handwriting, sitting still, or organizing their daily routine, get an assessment. If your child with autism or developmental delay has a sensory issues that have not been formally evaluated, get an assessment. The most common mistake I see is parents waiting. They think the child will grow out of it. In some cases, this is true. But with sensory processing difficulties specifically, early intervention changes the developmental trajectory significantly. Please do not wait for it to become a crisis. So, what should you realistically expect? First, an initial assessment session. This gives the full picture. Second, a personalized plan with specific, measurable goals for your child. Third, regular sessions. Thrice a week is the minimum recommended, but it can vary child to child. And results are rarely visible in few sessions. 2 to 3 months minimum is a realistic time frame to see meaningful change. Fourth, a home program. Your OT will give you activities to do between sessions. These are not optional. They are an important part of the process. And fifth, regular reviews every 2 to 3 months. Goals should be updated as the child progresses. These things have to be individualized. No two children respond to the same approach. I hope this has given you a clear picture of what occupational therapy for kids actually is and whether it is the right next step for your child. If you have a specific question about your child's sensory profile or OT assessment, drop it in the comments. If this was helpful, share it with one parent who has been wondering about occupational therapy but hasn't taken the next step yet. अपना भी ख्याल रखिएगा.